DNR orders are do not resuscitate orders, sometimes called do not attempt resuscitation orders. If a patient has an emergency and 911 is called, the emergency providers or first responders who arrive to help will first check if the patient has a pulse and is breathing. If the patient is not, then they will provide cardiopulmonary resuscitation or CPR unless there is a medical order saying not to attempt CPR. There are two medical orders that can tell them not to attempt CPR, a DNR order and a POLST form. A DNR order only tells first responders not to attempt CPR. It doesn't say anything else. A POLST form can tell first responders not to attempt CPR, and it can also tell them to attempt CPR. POLST gives patients a way to be clear about whether or not they want CPR attempted. There are many medical emergencies where the patient has a pulse or is breathing, which means first responders do not need to attempt CPR. A DNR order doesn't tell first responders anything about patients' treatment wishes. The patient will be taken to the hospital where the treatments that focus on saving their life will be provided, including going to the intensive care unit and being put on a breathing machine if needed. A POLST form, however, has three options that tell first responders and other providers what the patient wanted. The patient wants to go to the hospital and is okay being in the intensive care unit and on a breathing machine. The patient is okay going to the hospital, but does not want to be in the intensive care unit or on a breathing machine. The patient does not want to go to the hospital, but wants to focus instead on comfort and a natural death. There are lots of concepts covered in this video. Please watch others on our website and review the website to learn more.